name is Rebecca Lonkar. I'm a speech and feeding therapist here at Westside Children's Therapy. I hear all the time, my kid's just a picky eater, or they only eat a few things, but overall, they eat okay. Today I'm going to explain to you what a picky eater is versus a problem feeder and when a picky eater becomes a problem feeder. First of all, before I do that, I have to explain to you the difference between what a problem feeder is and what a picky eater is. So first we're going to talk about a picky eater. Picky eaters have decreased range of food varieties. They only eat about, I would say, 30 foods. Sometimes a little more, sometimes a little less, but the average range is about 30. Food loss due to food jag, also known as they eat a food until they burn out. However, they usually do regain the food after a 2 to 3 week break. They're able to tolerate new foods on their plate and can usually touch and or taste the new food with minimal motivation, eat at least one fruit from every texture category, frequently eats different sets of food than the rest of the family. However, they will eat with the family without tantrums and withdrawals from the table. Adds new foods into the repertoire after about 10 presentations, and sometimes reported as a picky eater by their parent at doctor checkups. Now, a problem feeder is a little bit different. They have a lot of the same characteristics, however, they're a little bit more extreme than just a picky eater. Problem feeders have restricted range variety of foods, usually less than 20 food items. Foods that are lost due to food jag, also known as burnout, are not regained after a 2 to 3 week period. Tantrums or withdrawals are presented when any type of new food is presented in front of them that is not within their preferred food group. They refuse entire categories of food by smell, texture, taste, color, or any other type of things such as just a visual presentation, how they look. A lot of foods, if they look similar, they won't eat them. A lot of times brands, they'll refuse different brands. We may think it's the same, but to them, it's totally different. Almost always eats different foods than the family and most of the time won't eat at the table. They will not regain a food after 10 exposures or regain a new food after 10 exposures. Persistently reported as a picky eater at doctor checkups. Now, this is something very important to note. Just because the child is not losing weight does not mean they're a problem feeder. Many times, due to their preferred foods, they eat the caloric intake based on their age. So normally, they're okay. Here at Westside, we have a feeding program that specifically targets problem feeders to help them learn about food, increase their food repertoire, decrease aversions of food items, and make mealtime fun again.